Okay, today we are going to give a sub-Q injection of 0.5 milliliters of heparin. The first thing that we're going to do is verify our doctor's orders, and then we're going to make sure the patient doesn't have any allergies to the medication. We do know that the antidote for heparin is protonamine sulfate, so we'll have that just in case there is an allergic reaction or anything that goes wrong with the patient. And then we're going to gather our supplies. For this, I'm going to use a 1 milliliter syringe and then a 25 gauge needle. You can also use 23 gauge and 26 gauge plus 25. And then the needle length can be 3/8, 5/8, or 1/2. So now I'm going to wash my hands. And then for the medication bottle, before I administer it to the patient, I'm going to check it once in the MAR, once while I'm preparing it, and then once at the patient's bedside while looking for the expiration date. I'm also going to go through my 6 rights: the right patient, the right dose, the right medication, the right time, the right documentation, and the right route. So now I'll take my alcohol swab and I'll clean the top of the medication vial. Then I will get my needle ready, remove the cap, and draw up 0.5 milliliters of air. And inject it into the medication vial. I'll then lift it up and withdraw 0.5 milliliters of heparin, making sure that there are no bubbles. I will recap this needle using the scoop method. And then I'll change out my needle to the correct needle gauge. And then I will label this and transport it back to the patient's bedside. So when I get into the room, I'm going to wash my hands, apply my gloves, introduce myself to the patient, and explain that I am going to give them a heparin shot subcutaneously. I will then ask the patient if they have any allergies and check their armband to see if they have an allergy armband, and then identify them with 2 identifiers. So I'll ask them their name and their date of birth, and then I'll do a focused assessment. I'll look at their vital signs, lab results, any therapeutic or adverse effects of the medication, if they're experiencing any pain and where the pain is located at. And then I'll identify my sites. So we have the back of the arm, the love handles, the top of the buttocks, the upper outer thigh, and then your abdomen. So for the injection, I'll clean the site where I'll be administering heparin. I'll wait for that to dry. With a sub-Q shot, you can go 45 or 90-degree angles. So I'll remove the cap. I'll pinch the skin about 1 inch up. I'll, in a dart-like motion, 90 degrees, I'll slowly insert the medication, withdraw, I will not rub, and I'll dispose of this needle in the sharps.